Welcome, everyone. Today, we're tackling a critical issue that's increasingly affecting our planet and our health: the dangerous connection between climate change and wildfires, and specifically, the alarming health crisis sparked by wildfire smoke. It's no secret that our climate is changing. Rising global temperatures, driven by human activities like burning fossil fuels, are creating drier landscapes, longer droughts, and erratic weather. These conditions are turning our forests into tinderboxes, leading to larger, more intense, and harder to control wildfires. But the danger doesn't stop when the flames are out. The smoke from these massive blazes is a complex cocktail of pollutants. Think fine particulate matter, or PM 2.5, so tiny it can invade deep into our lungs and even enter our bloodstream. This isn't just a local problem, it's a global health threat. Recent research paints a grim picture. One study found that in the US alone, human-caused climate change contributed to an estimated 15,000 additional deaths from wildfire air pollution between 2006 and 2020. The economic burden of these deaths? A staggering $160 billion. And the situation is projected to worsen. Without serious climate action, mortality from climate-driven wildfire smoke in the US could jump by at least 50% by mid-century, with annual damages reaching $244 billion. Globally, the numbers are even more devastating. It's estimated that over 1.5 million people die each year from illnesses caused by pollution from wildland fires. The vast majority of these deaths, over 90%, occur in low and middle-income countries. Some projections even suggest that climate-driven increases in smoke could lead to nearly 28,000 excess deaths per year in the US by 2050 under a high-warming scenario. That's a 76% increase from recent averages. Beyond these tragic fatalities, wildfire smoke leads to a host of other health problems. We're talking increased asthma attacks, reduced lung function, and aggravated COPD. It's linked to a higher risk of heart failure, heart attacks, and strokes. Pregnant women face risks of preterm birth, and young children are especially vulnerable. And let's not forget the mental toll. The trauma of experiencing wildfires can lead to PTSD, anxiety, and depression. There's even emerging evidence that PM 2.5 from wildfire smoke may be more toxic than that from other pollution sources. This creates a terrifying feedback loop. Wildfires don't just result from climate change, they contribute to it. Burning vegetation releases massive amounts of carbon dioxide and black carbon, further trapping heat and worsening the climate crisis, which in turn fuels more wildfires. So, what's the path forward? It's clear we need a multi-pronged approach. First and foremost, we need urgent, aggressive action to reduce greenhouse gas emissions. This is fundamental. We also need improved forest and land management, like prescribed burns, to reduce fuel loads. Public health measures are crucial. Better air quality monitoring, early warning systems for smoke, and access to clean air spaces, especially for vulnerable groups. Finally, governments must adopt coordinated policies that acknowledge the interconnectedness of climate change, air pollution, and wildfire risk. The science is undeniable. Climate change is fanning the flames of wildfires, and the smoke is exacting a heavy toll on human lives and our economies. Without decisive action now, these impacts are set to escalate dramatically in the coming decades. It's a crisis that demands our immediate and sustained attention.